Hi, everyone, and welcome to the last episode of Arthritis at Home for 2020. Today, we're joined by ACE's president, Cheryl Koehn. I'm Kelly Lendvoy, VP of Communications and Public Affairs, and it's our pleasure to be able to not only send our holiday greetings to all of you, but also a chance to talk about the year of COVID. And it was actually because of COVID that we started Arthritis at Home. We now have over 55 episodes, I think, that people can view at their convenience, at home on their computer, on their phone, on their tablet, and by podcast. Really proud of this program. And it's one of the things that I think, Cheryl, you're going to talk to our audience about in terms of some of the things that ACE has been able to achieve this year in a very difficult and challenging year. And maybe that's a good way to start your Christmas message to all of our audience across Canada. As one of the leading arthritis advocates in Canada, what stood out to you in terms of arthritis, in terms of models of care for arthritis during the year of the pandemic?
And what strikes me now, looking back over the last 11 months, is I think a societal-wide empathy that was developed, actually, and maybe a slightly deeper understanding that was developed on the part of people who are not disabled, who are abled, and who looked at the challenges they were facing, and having, not everyone recognized this, but certainly a large number realized that so many people who are disabled and who have been affected by chronic diseases or acute diseases have been dealing with a lot of pandemic-like issues their whole lives with these chronic diseases. Feelings of isolation, those are not unfamiliar to people who live, for example, with rheumatoid arthritis or another type of autoimmune arthritis. The day you're diagnosed, you become isolated. And so where I feel our community, our arthritis community, has maybe been less impacted is in this area. And I think this society of people or ableds, as we like to call them, have really recognized that, now they're kind of having to go through some things that these other communities have gone through for a long, long time.
So it's interesting, that point, because certainly our viewers have read on our website and have heard on Arthritis at Home about how arthritis is the leading cause of work disability in Canada. And we developed a program in response to that called Canada's Best Workplaces for Employees or Employers and Employees living with arthritis. And what's interesting is when we've talked to a lot of those employees living with arthritis is how difficult it has been for many of them to receive job accommodations. Mm-hmm. And if one of the themes of this year has been how COVID has disrupted the workforce, the way that employers have responded by adapting their work environments for abled employees to continue to be productive individuals, the pandemic has seen a corresponding rise in mental health issues. Mm-hmm. And one of the things that you're describing in terms of our community is, and hopefully this empathy for people to start to understand that these obstacles that our members face, whether it's fatigue or pain or stress, often leading to depression and mental health issues. Maybe there's a better understanding now when we talk about those factors with the rest of the population. They have a better understanding of what our members are going through every day at home and at work.
Abled community, a disabled community, I think we're also all learning together what virtual care means, right? This has been an awakening for every Canadian is a patient at some point or another. It's the degree to which you rely on the medical system or the health system to help you live your life. And if you have a chronic disease such as I and our members do, the contacts are frequent. We wish they weren't, but they are by the nature of our disease. And virtual care has really allowed people and has helped with this mental health piece you're talking about, Kelly, to know that there is that you can reach out and talk to your physician by the phone or through a video facility like this. That has actually, I think, done a lot to keep people who are isolated, whether you're living with a chronic disease or not, kind of connected to their health care, whether it's infrequent or frequent. We're fighting, as you know, to say virtual care is here to stay. And I think many other communities in chronic disease are saying the same thing, that if we have a disease that's where our challenges are linked in large measure to mobility, why can't we have a 15-minute follow-up visit like this? Why can't we do a medication review like this? Now, that's not to suggest there shouldn't be in-person appointments when it's safe to do so, absolutely. If I need a joint injected or aspirated, if I need to have a very detailed conversation or have some other physical manifestation that requires attention of a medical professional, that's certainly going to be an in-person visit. But I think we need to, and ACES, this is a pillar of work we're going to focus on in 2021. ACE is committed to working with policymakers to, one, know what kind of virtual care our community needs and is asking for, and two, how we can build it into the system and sustain it moving forward.
You nailed it. And what the policymakers are trying to grapple with right now is how to integrate it.
Yeah.
First of all, do 37 million Canadians have equitable access through internet and broadband to be able to access virtual care? So they're spending money on that. But then the integration is really the discussion right now, and arthritis has to be at the table. And that's certainly one reason why it has become a focus for us, representing our patients when these decisions are being made in terms of what's the best way to integrate it, how do we integrate it into models of care, which our audience knows is one of the causes that we champion as well. Ensuring that the perspective of the patient and the arthritis patient is incorporated is really, really important. I know there's one other, maybe two other topics that I know touched you at a very personal and deep level. And that was the Black Lives Matter movement in North America and around the world. And then secondly, the health inequities that were exposed during COVID, where we saw certain populations much more adversely and disproportionately affected. Maybe you want to just touch on those two, because I think that'll be a nice way to lead to some of the advocacy work that you said that we are looking at in 2021.
Yeah, obviously you had to have been living under a rock not to be affected by the events that unfolded this summer and throughout the second half of this year in terms of the social justice movement, the racial justice, criminal justice reform movements, led by Black Lives Matters at the start. And here in Canada, obviously Indigenous rights roll up right with that, and the injustices being faced by our Indigenous peoples in Canada must be addressed. And in the United States and here in Canada, the Black Lives Matter movement really, I think, showed all white people, I'm going to use this very basic term, white people, that there is a deep, deep wound racially in our world, and injustices that have been baked into our systems. And I'm not just talking about the criminal justice system, but in our healthcare system, in our environment, in our housing, in every single way in which we live, there are racial injustices. And we can no longer as a society live like that. I am absolutely committed to being a part of the change that is needed so that everyone is on a level field in life. And I think in Canada, we just published, as you know, Kelly, a very important issue of our Joint Health Web Insight. Of course, in this issue, we're indebted to Graham Reed, who worked with our team member, Maya Joshi, to really, I think, in the space that was allowed, lay bare some of the issues that Indigenous peoples in Canada face, not just in healthcare, but in these other realms that I've been referring to. And as you say, this work, this health inequities work, is embedded now and is the foundation to the work that we're going to be doing now and until these things are addressed once and for all, to the satisfaction of these communities. Really going to work hard on stepping up and being their true partners in making change. And that is going to happen in arthritis, in our community, in our ACE community, through our advocacy efforts. We've completely retooled our advocacy section on our website to help people step up.
To sort of tie this neatly around, I mean, you started the conversation by talking about empathy and understanding, and then went on to describe some of these groups who people gained a new understanding and found empathy with, whether it was the disabled over the course of the last 9 months, visible minorities, and the inequitable health care they were receiving. The last one I think you touched on were rural and remote populations, that if what we could hope for is that this empathy and understanding lasts. And if it lasts, that means that those groups, those populations are going to be recognized and, most importantly, listened to. And I guess what we're trying to do is provide a platform for those voices to be heard.
Yeah, absolutely. I think that's sort of the role that ACE has played for a long, long time. We're now going into our 21st year in January, Kelly, and we've seen so much. Our team has seen so much good, but also still so many challenges. And like you, I am really a glass half full kind of person. I really think that we can harness some of this connectedness we felt by being apart. You know, people have felt in some ways more connected than we did when we could connect physically, because we had to work at it. We really had to work at stay connected and use creative ways to do that. So I just, want to thank you for this conversation. Thank our whole ACE team for stepping up every day, all day of the year to do the work that we know helps people with arthritis across the country. We all, and to our members, to our subscribers, to our watchers and listeners, every day is about you, and we are one. We are by, for, and with people with arthritis, and we just want to thank you for who you are, for being who you are. The arthritis community is beautiful in every single way. So thank you very much. We hope you have a really lovely holiday season, And we can't wait to share more episodes of Arthritis at Home with you in the new year, and all of the work that we're doing in these areas that we've discussed here today.
Well, that's a lovely way to end this final episode. You're probably going to thank me because I was going to do my Dean Martin Silver Bells. And fortunately, we've run out of time.
Excellent.
So happy holidays, everyone. And we'll see you at Arthritis at Home in the new year.